Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and if you're new to us, we are very excited to have you here. Welcome, welcome. And we're excited because a few different things. We're excited because we're having some really interesting conversations with leaders that are painstakingly reshaping the future of healthcare. And we're passionate about a few different areas. We're passionate about healthcare innovation, leadership, access, and innovation adoption. If it's your first time tuning in, let me just take a very quick step back and just dig in a little bit more and tell you more about what we're trying to get done here. So, our focus is bringing real stories of innovation to life, not just theoretical things, but highlighting real people that are doing real things within our space and giving them the opportunity to share their stories with our community and ultimately with the world. So, we've got an amazing action-packed year wherever you are, whether you're watching this or listening to this, please hit the subscribe button now so that any new interviews come directly to you. So today's guests, they didn't just set out to start another healthcare company. Okay, they saw a massive gap in pediatric medication management and made a bold decision to actually do something about it. So I want to introduce the two guests. So we have Lyle Mioduszewski. Definitely butchered that, but I tried my best.
No,
He's a
no, it's
clinician
perfect.
turned executive who's walked the walk. He's got to start. He got to start actually in the emergency department while he was still in high school. That early experience shaped his belief that advocacy begins at the bedside. So from there, he traveled the country as a nurse before stepping into leadership roles at big entities like Zoll and McKesson and Datavant. And he could have stayed in the corporate world. Instead, he chose to come back to care delivery, the part of healthcare that still kind of gets him going, keeps him up at night, and gets him out of bed in the morning. And then we've got Dr. Jena Quinn, who is a nationally recognized pediatric pharmacist. She's built her career optimizing complex medication regimens for some of the most vulnerable kids in the country. And she combines both clinical depth with operational know-how, and she kind of brings sort of the human side of that to her work. She's also a mom of three, so I don't know how she's running a company, momming three kids. So she knows that the stakes are really, really, really high. So together, they co-founded an entity, a company called Perfecting Peds, with a very simple yet radical belief. Children deserve better, not someday, but right now. So in a healthcare landscape that's really obsessed with Medicare Advantage and senior care, they're reminding us that innovation in pediatrics, it's not just overdue. It's essential. And they've built a company, like a real company that doesn't just consult. It implements. It doesn't just talk to systems. It listens to families. So we're going to kind of go through a lot of different areas today, talk about what it looks like to really step into a problem that most people overlook, and they committed their lives to fixing it. So this conversation for me, it's about precision, passion, and what does it look like to actually show up for our kids in ways that truly matter. So, Jena, Lyle, welcome to the show.
Thank you for having us. You should do our marketing. That was a wonderful, wonderful introduction, Mike.
Well, I try to do where it's like you're trying to hype up the people. So we've even just been thinking, what if we did like a little bit of entrance music? So I'm in Chicago, so maybe we had the Chicago Bulls entrant theme song. You know the song, it
Now we're
just gets
talking.
people riled up and pumped up. Yeah, yeah, yeah.
I love
So,
it.
okay, all right. So now that we've set the tone, I mean, you both have roots in clinical care, one from ED, one from the pharmacy, as I mentioned. And if someone asked you like how your two worlds collided to create Perfecting Peds, how would you explain that?
Oh boy. It's a very random story, but so I was a pediatric pharmacist at a hospital. So to date, I didn't know this when starting the company, there's only 1,700 pediatric pharmacists in the US. So we have
Whoa.
this really niche training where like we truly are the biggest dorks when it comes to medications and pediatrics. And so we go to pharmacy school, get our doctorate, do residency, and then we get board certified in pediatric pharmacology. And today, outside of perfecting peds, you'll only find a pediatric pharmacist in the acute channel. So most of the time in a large pediatric institution slash
Right.
hospital. So my preface or hypothesis was that, this really trained resource that has the ability to manage children's medications better than anyone else in the world really
Right,
should be outside of the hospital preventing the kids from coming in.
right,
Um, Having three kids of my own, almost every script, I would say 70% of the time, something was wrong with the script. It was the wrong concentration. It was the wrong dose because I didn't weigh my child that visit. It was the wrong dose because based off the indication or something was missed. And so I always kept going back to the thought of what does a regular quote unquote parent do that doesn't have this type of background?
right.
And the answer was they just trust the system, right? And
I
so
can tell you as a regular parent of three, what do? You trust the professional. There is a level of trust. And now there's obviously a large degree to some degree from my perspective, there's a little bit more skepticism and question asking. But yeah, not every kiddo is lucky enough to have a parent that's a pediatric pharmacist. I mean, that's very, very niche.
and I love it. And the reason why, like, building the millions of pitch decks and talking to all the investors, they drill into like, well, what's the problem? And so I saw the problem and I wanted to solve it. And I kind of jumped in to do that. But when you pull back a little bit, the stats are alarming. So 1 in 3 pediatric prescriptions, 31% of prescriptions leave the pharmacy in the United States contain an error. And that was by a really big study by the United States Pharmacopeia Medication Error Report in 2023. So that's a known fact. And when you think of why, it's because 85% of the time we're writing a script prescription for a child, but it's actually off label. So there's not real robust studies behind it. The other reason is that in the retail space, which we're advocating for on a legislative level, is the person that's filling your child's scripts doesn't have their weight. And we dose all medications based off their child's weight. So if the
Mm,
person filling the script doesn't have that weight, that means there's no double check. They're just blindly pushing them through. And then the other reason is that, like, just like in the geriatric space, you have your million specialties and subspecialties, and they're focused on their one organ, their one disease state, their one medication, but nobody is quarterbacking the entire med regimen. And if you ask us what our value add is, it's that. It's that we can see what the neurologist and the psychiatrist may be treating the same thing, but it could be with one med instead of the three that they're on, or what the GI doctors writing their scripts for is
right.
because they're treating the side effects of what the pulmonologist is writing for. So, long story long
Hmm.
is I had no idea. I don't have the business background that Lyle has, and I am learning every day. But I just saw an opportunity with kids locally that were
Hmm.
complex in
Hmm.
facilities, and I asked them just to really take a bet on me and do a value-based care contract locally with me and my team being embedded in children's care in various skilled nursing facilities in the New Jersey
Right.
area. We studied it and we published it, and I'll let Lyle articulate the publication because I think that's what won him over. But once I found the study results and we started going through the process of publishing it, I was like, holy crap, I think I found something, but I don't have the business acumen, and I'm still very Jersey, even 4 years in. So I found Lyle on Y Combinator Founders Match to polish me, if you will, and make me a little bit more business savvy. So we found each other on the internet looking for a fellow founder and co-founder. So I will let Lyle take over the rest, but it was
That's that's
very
awesome.
random.
Lyle, I just want you to add more color to that with the context that you've worked at some pretty big companies and you've seen how innovation either typically gets funded and prioritized. What actually made you realize, aside from the study and the findings, that pediatrics really sort of needed a completely different approach?
Well, you were making the hair on the back of my neck stand up during the intro, and Jenna will second this, that like we throw so much in this country into revenue cycle management innovation for Medicare Advantage
Yeah.
populations since the early 2010s, that when I saw something that fell outside of it was in care delivery, and the outcomes that I had read in their manuscript before I came on board were nearly unbelievable. That I convinced myself that if they were real, I'd drop everything I was doing and try to help Jenna evangelize this thing, and really take it from what she had started and proved out as longitudinal clinical pharmacy in skilled nursing and long-term care centers to a population health-based tool that could reach anybody in
Hmm.
their home. So it was like I hadn't read this Y, and we're really plugging Y Combinator. You're welcome. But this like this founder match thing, it wasn't intentional to find a pediatric solution. I joke the first, and they're not around anymore, so I think I can say it. But the first company to match with me was called Cool Dem Balls, and it was a post vasectomy cooling device. And that's what they named their company. So I had built this profile,
Oh
really
my
like,
God.
man, I want to get back into care delivery so bad, and then I matched with that, and I was like, wow, what a waste of time. Well, like the next time I rubbed um the bottle, like a little genie, Jenna popped out, and she was doing some stuff with pediatrics, and I'll oh, am I
A little bit.
No,
frozen here with
you're
you?
still good. You're a little frozen, but it's okay. We'll deal with it.
You
Well,
just look
as you
surprised.
he looks surprised. So why don't we give you a surprising question? Okay.
That
Because
was
you
good.
said something. When you when I think about medication management, I think about like adult formularies, not like weight-based dosing or child-specific like risk profiles. Why has innovation been so stagnant in this space?
Oh, you want me to go?
Yeah, I
Sure.
think I was frozen, so you go first, and then I'll catch up.
Okay.
Yeah.
He's just Lyle, innovation in the pediatric space. I think it all, and it's kind of wild. I can tell you, I'll speak to innovation in the pharmacy space specifically, and let Lyle speak like on a pop health level.
Mm.
But
Mhm.
um, I think a couple things when I think of why this hasn't happened. There's a really small N of us, right? So there's only like 1,700 of us that know this is a problem. Um, Pharmacists, we're a thing. We have a very certain personality, and I don't think I fit all the boxes. I mean, I'm very type A, and I'm medicated for my anxiety, and you can never medicate that away. But there's like a portion of I think we're all so used to and very black and white. So if you tell a pharmacist like, here's what you're going to
Right.
do for the rest of your life, we're like, okay.
Okay.
And so I think, it's not in our blood to be entrepreneurs. Just by way of our training, we're like completely told to avert risk. And funny enough, and totally unrelated, I got my entrepreneurial spirit when I was trying to figure out like how the heck to get out of the hospital for 40 plus hours a week. And I sold
Hmm.
skincare and I loved it. And that was like the combination of the two that led me to have the courage, like seeing the opportunity, but then also having this like little glimpse of what an entrepreneur could do was what spiraled this whole bad boy. But I think it's that not a lot of people really understand the gravity of the problem in pharmacy. And once we started talking to big companies and like brought to light, like, hey, this is what's happening. It sparked some amazing conversations and changes and contracts, et cetera. But I also don't think that's where the money's at, which I think is what Lyle's going to tell you.
All right. I have a question. I'm going to let Lyle comment, but you sparked a question. Go ahead, Lyle.
It depends. Again, I think Jenna hit it right. Like, it depends if you're talking about pediatric innovation or pharmacy or pediatric pharmacy innovation. I think on like the full pediatric part of the question, like this is a small slice of the small slice of the risk that's out and about in the ecosystem of healthcare, right? Like most kids are
Right.
healthy, most kids are not sick. like we think that the ones that are have the most life to live, and we should probably focus on them. And nobody's innovating there, so we should. But in the grand scheme of things, like think about ACOs in the Medicare population, where providers are starting to take risk, and you're seeing value-based care become a thing, upside and downside. On the pediatric side of the table, like those are few and far between, and
Yeah.
we're just starting to get there. And so, like, there's not all of these solutions and people thinking, hey, I need to make solutions in that regard because nobody's really willing to pay for it. And you've got to go in and convince people to pay for it. You've got to create buyers and you have to create a return on investment story that isn't available really anywhere else and really unfounded in this population. So we're talking
So
about
shape
things in
that. Let's shape that. Let's shape that for a second. So if perfecting peds didn't exist, what would continue to happen to these families and care teams? Like perpetuate the problem, like magnify it so that we can put a shape to it. Help me understand.
Do you want me to give
uh,
go ahead, you go first, and then I can give a more like clinical example.
Yeah, well, I was actually going to say, like, we're going to continue just going down this pathway of keeping people alive for longer, creating more drugs to treat those diseases and symptoms, and then compounding the problem because there's just very little guidelines and standardization on the way that we're treating, especially when a disease state is compounded by another disease state and the child's growing in their own regard. And so you stack all those things on each other. No one's looking at the management of medications across subspecialties in this population. And like there's really no one, right? Nobody's coordinating across each of those prescriber types. And so as the first group that's doing this and documenting it, we think we can layer things on top of this, layer learnings on top of this to understand what does this look like long term as we continue to add more meds. Without it, the problem just gets worse. We add on more medications. We treat side effects of medications with other medications. We diagnose people with diseases that are actually the side effects of medications, and the problem just compounds on itself. Jenna, go ahead and drill in on that.
Yeah, I mean, you articulated what I was going to say. Also, I think one thing to add is that, Mike, because you're asking what the problem is, and this is a little bit of a squirrel, but it's really important, is in pharmacy schools, not all pharmacy schools even
Mhm.
teach pediatrics, and in most schools in the US, it's just an elective that you can may or may not take. So
Okay.
99% of pharmacists graduate from school without any pediatric exposure, and we're hell
Right.
bent on changing that too. We're actually
Right.
partnered with 7 schools and growing, to just grow the next generation of pediatric pharmacists, which
Hmm.
is definitely one
Hmm.
of the root causes of this. But to Lyle's point, I feel like we do give families a little bit of hope, as cliche as that sounds, because they've had a lot of people just like that they can meet with us, and their first time meeting is virtual, and we spend a whole hour with them. So we're going to find out and talk about how your child stools, how they eat, what their diet is, how they're sleeping, because as a pharmacist, we're thinking and connecting all that stuff back to possible side effects.
Yeah.
So I can tell you, like the first patient that I ever had still see, that was the reason I started this company. He was on 2 antipsychotics, which no one in the world should ever be on 2 antipsychotics, and was on a breathing treatment that was left on 7 years
Hmm.
old, that he was accidentally discharged from the hospital. The combination of those meds were, which nobody had pinpoint, was the reason he couldn't urinate and he was being catheterized, was the reason he
Wow.
was having constipation, having fecal impaction, while he was constantly in and out of the hospital.
Whoa.
Um, and that's just one of the parts of all the things that were miscoordinated. And it took me to contact the primary care doctor and say, hey, like he's been on this drug, why? And it was rooted back to a discharge 7 years ago. They're like, I don't know. We didn't know that this wasn't from a pulmonologist. We got him in with a pulmonologist. And then because of the combination of psych meds, he was having all these issues with, I mean, obscurely high triglycerides and cholesterol. And so rotating him to a safer med that was more effective using pharmacogenomics, the parents' lives completely changed. And so He was no longer being straight cath. He was no longer having constipation, which was also causing his behavior because he was a nonverbal autistic child, and he was having
Mm,
control on his behavior because he was on the right meds for his psych issues,
hmm.
but with minimal the side effects that he was experiencing before. So again, that coordination is where we really lack in pediatrics because you would think it'd be the retail pharmacist. They don't
Right.
have the training. And then the PCP will openly tell you, I'm not comfortable touching a subspecialist med
Hmm.
because I don't have the training to know
Hmm.
even like what it's for, let alone how to dose it, use it, monitor
Right.
side effects, etc.
Wow. So I can't get my mind off the fact that there's only 1,700 pediatric pharmacists. So there's a massive delta in demand of kiddos that need these services and the supply of clinicians. Is that a gap that technology can close? Possibly.
Yes. So we built our own, well, take a step back. For 3 years, I felt being a tech company because I was like, I'm not technologist. I don't know the first thing about tech, etc. But I explored, and I'm not exaggerating, hundreds of CRNs, hundreds of MTM platforms, hundreds of EHRs, and
Hmm.
none of them outside of Epic. And they told me I was too small to play in their sandbox. Um, could even do the basic thing, which is weight-based dose medications.
Right.
Like that is the 101 of pediatric pharmacy. So we're building our own proprietary pediatric pharmacist EHR on Salesforce Health Cloud, which has been amazing.
Hmm.
We've integrated
Hmm.
in a lot of clinical decision support, and our 3-year goal is that after we have all sorts of automation inclusive of clinical protocols,
Hmm.
your buzzword AI, et cetera, that
Right. Right.
with support of our pharmacists, our pediatric pharmacists and adult trained pharmacists could plug into our technology and take care of a medically complex kid. Because absolutely, Mike, that's going to be our bottleneck is the amount of
Mm.
trained clinicians. And so we're trying to do innovative things like do residencies, take students, develop more and more pediatric pharmacists. But eventually, I think we're going to have to tap into the adult pharmacist market for sure.
Mm. One thing that you mentioned is that how you're kind of embedding yourself into workflows that are directly improving outcomes. And now that you're building this technology, I'll call it as a way to make things more efficient to document. Are you still thinking of yourself as a care delivery company, or do you see yourself as now sort of a quasi moving into a tech company, just kind of given the the impact that you can have with other pharmacists that can leverage this to maybe get access to pediatric pharmacy, I'll call them tools that they wouldn't necessarily have had access to before. Yeah, Lyle, take that
Lyle, I
one.
was going to say, take that one, Lyle.
I think after we solve how to utilize this internally, the sky's the limit of what could be done
Mm,
elsewhere from like a software SaaS perspective. We've talked to some of the largest retail pharmacy chains in the country about the errors that are going out their front door, and they're interested in understanding what they can do to mitigate
mm,
that a little bit more. In the hospital and the lay public a lot of times has a hard time discerning retail dispensing pharmacy from clinical
right.
pharmacy. But in the hospital, that clinical team isn't touching pills. They're having conversations, looking at data and assessing patients to partner with the providers, the prescribers, and understand that what is being ordered on that patient is useful. It's going to take care of the problem and it's not going to cause any harm. That's not happening in the outpatient retail dispensing pharmacy world. We think that at a certain point, one, we'll have better evidence of what combinations of therapies with what pathophysiologies and what outcomes make the best plan of care, but maybe beyond that as validating prescriptions at the point of dispensing and truly understanding that we have the right meds on the right patient. And I think
Yeah.
technology will be able to and experience will help us be able to get to that point.
Mm. Jenna, you mentioned something earlier that just triggered just I'll call it trust. like there's a real sense of trust in what you've built. And you mentioned that there was a hospital that took a chance on you. They lent their credibility to you and what you've done. Um, who is that hospital? Let's give them a shout out, just because I don't think innovation happens unless someone lends their credibility to someone else to actually trial something to get data and information back. And I guess since you've developed that model, I think, what have you done differently to kind of really elevate that trust to continue to sort of scale the company?
Yeah, I think if you talk to a lot of entrepreneurs and founders, it was just like a key couple of people that believed in you. And sometimes they believe in you when you don't even believe in yourself. That's pretty, I'm sure. You're like, okay, well, they think I could do it, so I can. Mike Rosiak in one of our skilled nursing facilities in New Jersey, he was the guy that again, it's hard to sell innovation to skilled nursing facilities, medical day. I didn't know this. I just kind of
Yeah.
said, this is a really good idea. Let's do this. And when Lyle joined and we tried to scale this, taking it to other skilled nursing facilities, they basically laughed in our faces, which was why, like, the ultimate beneficiaries, as Lyle would tell you, is like, you have to sell this to healthcare plans. Like, the skilled nursing facilities don't even have enough money to get by on a day to day. And it was really Mike and his belief in me. And I still obviously keep in touch with them and we have still take care of their patients. But it was him being like, okay, so he luckily via our networks overlapped enough where some
Hmm.
of the clinicians in the skilled nursing facility had worked with me. And that was, again, if I didn't have that, I wouldn't have been able to have our study which showed our impacts, and I wouldn't be able to then
Right.
take those findings and pivot and really show the health plan our worth, because to date, we haven't really been able to articulate our value add to the care team, specifically in the ambulatory care space. So it is always that one person. And I've had definitely a few mentors along the way that I wouldn't have been able to do it without, and he is definitely one of
Mm.
them.
Mm. When you think about like the ripple effect of what you and Lyle and the team are doing and what you're building, what other parts of pediatrics could benefit from what you're doing?
I think, and maybe not just in pediatrics, but the pharmacist as a provider type has been this like growing wave since COVID.
Right.
And I think
Yeah.
it continues to motivate them to understand that they have a lot of worth and there's other parts of this care cycle and care continuum that could probably benefit from them being entrepreneurs and innovators.
Mm.
Um, it's, I think I lost connection earlier, but one of the things that motivated me before getting here was watching clinical pharmacy get stood up in a department where it hadn't existed before. And so I was in a
Hmm.
community hospital working in an ER, and I watched what good that oversight and collaboration did for the patients when it was the prescriber, the pharmacist, the nurse, the respiratory therapist, and social work and everybody else who could be part of that team could come together. And I think like the ripple effect for me, it might not be just pediatrics, but I think amplifying the role of somebody that has an extreme amount of didactic education, and most of these people are
Hmm.
residency trained too, and they've been limited in their ability to like take that expertise and spread it. That would be my response.
Mm. Mm. I maybe shift gears for a minute, just because you guys are so close to the care delivery aspect of it. Um, I mean, maybe we can just sort of share a moment that, that wrecked you in a good way, where maybe there was a patient, a family, a breakthrough that reminded you like, yeah, like this is why we're doing this. Any come to mind?
Oh, I have a couple. One person I was able to work with take their kid from having 100 seizures a day to being seizure free in 6 months by
Whoa.
selecting the right meds. And as part of his first year birthday, they asked me to write him a letter of what I would say to him at 18. And it was particularly a private pay patient. So they spent money for
Hmm.
me to be part of the care team.
Hmm.
And I just thought like how cool. Like I wrote to him as, his 18-year-old self saying like, thank you for letting you and your parents for letting me be part of the care team because in 18 years, like, perfecting Peds like the cocky person I am is going to be a household name. And so thank you for being a part of that. And then oh God, the amount of around like mental health. I had one kiddo that was completely mismanaged. I took him from inpatient. I don't know why he answered. Well, he went from answering the phone, being on drugs in a hotel, to coordinating with his parents to get him inpatient, to then getting him outpatient on the right meds. It took us like 2 months to get him there, to now a functioning member of society, and we chat
Wow.
monthly. So it could be like, hey, I can't say his name, but hey, buddy, like, it could be, how did you get your labs? Or I'm like his annoying mom. Like, are you, like, did you get the vaccine? And he's
Hmm.
so good and responsive. And we even talk because I've been seeing it for 2 years. Like, I know everything. I know about his family. I know his animals. I know what he likes to eat and all those things. And seeing him go from crippling addiction and untreated bipolar diagnosis to you know great physical and mental health has been so rewarding. And those are the stories that break me. One more line, I promise. The other big one was a caregiver had never in 2 years hadn't been able to hug her child, and we were able to get the right meds in them, and she took a picture and emailed to me a picture of her and her son hugging. So those are the moments that break me, that I'm like, okay, although
Yeah.
some days are really hard, this is so worth it.
I mean, what do you do to kind of get through some of those dips? Just as founders, know what it's
Yeah.
like to be in the seat, and some days are really hard. What keeps you going? Do you kind of dip into that little bank of little wins? I call it my little wins jar. I got a little jar here that's got all my little wins in there, my little
Good idea.
post-it notes, date
I
them and
I
everything. But yeah.
mine are like I get to live them through the experience of the pharmacist and Jena. But there's several names that have ended up on my whiteboard that I walk in every morning and see, that remind me why we're here. And some of those people aren't here anymore already. And so like there's a really sad part of this job too, whether you're on the front line or behind it. Michael, I'll say one other thing, and it's a hard thing to talk about, but it's a reminder on a constant basis. We cold call families essentially on behalf of their health plan and offer them a benefit they've never heard of. Sometimes
Mm,
when we call people, we arrive there a little too late, and that is a very quick like the other people I'm getting a hold of, we have time to help. And for
mm,
those families, I'm super fortunate. My kids are generally healthy. That's not the case for everybody else, and it's like a constant reminder of what we're really doing here is life and death and quality of life and satisfaction and hopefully helping somebody have a better day.
yeah. All right, we're gonna finish up with on a fun note. We're gonna do a little lightning round here. Okay. So I'm
Okay.
gonna say something, and I just want you to say what comes to you. Um, you're both parents. What's harder, parenting or building a company?
Parenting.
Parenting.
Hands
Okay.
down. I wear an Aura ring, and on the days that I just parent, it's like your stress has been abnormally high today. I'm like, yeah, no crap. Like I know.
I look forward to Mondays.
Yeah.
All right.
Yeah.
All right. What's like one pediatric medication myth that kind of drives you crazy?
Oh, there's a lot of them. One myth. Well, okay. This takes the cake, hands over. If it's an over-the-counter drug, it's safe. My biggest life bugaboo. Many of them are not.
Hmm.
And many of them are not in specific disease states and age groups, but a lot of parents think if it's over the counter, I don't have to check for drug-drug interactions. I don't have to consult with anybody. And sometimes they're the more unsafe drugs, which is one of probably the big repeating myth that I see with caregivers.
Okay.
Mine's probably like piggybacked off that, like the hidden drugs in over the counters, like the combo drugs, the
Uh,
NyQuil, the DayQuil, and then you're on something else that has the same ingredients. Um, and then the last one is like you've probably heard this at this point, but people are still requesting it. Even my own family sometimes like, oh, Hudson has a cough, get him some cough syrup, like cough syrup that takes away your cough magically. If you find it, let me know. I want some.
it's not, it should never be given to children. So I'm like, have them drink water and parents hate me. I'm like, it's not safe in kids, so just have them drink water to, thin out their
So
lead.
maybe you just answered my other question, which is what's one thing you wish every parent knew? Is it that cough syrup isn't magic? And
Um, one thing that every parent knew for me would be that like the ideal measuring instrument and the only one you should ever measure medications is an oral syringe. It's not an oral cup. It's not like what my husband does, like the top of a bottle. I mean, I was shocked one day when I called him measuring our own kids' meds, and I was like, I'd rather you have an affair than measure this
Mhm.
with. He was using like the top of a cat bottle. So I feel like, oral syringes are the only thing, and you can actually ask for them for free from your pharmacy. So all the pharmacists
Okay.
have like stashes of them. So even the medicine cups that come on top
Yeah.
and they're actually
Yeah.
dispensed with the manufacturer, they're usually more than 10% inaccurate, which is kind of our general rule of thumb when thinking of, it's kind of close in pediatrics. So that would be the one thing, because it drives me crazy that the manufacturer even puts a cup on it, and parents probably think it's okay to use.
Wow. Fascinating. All right. And then just lastly, what's the best way people can follow your journey? Maybe just kind of give a little commercial for Perfecting Peds.
Yeah, hopefully we'll be making some big announcements here soon, so you can kind of stay tuned for that. If you're not following us already on socials, you can follow Perfecting Peds on LinkedIn, Facebook, Instagram, and then our website is perfectingpeds.com, and check us out there.
Awesome. Well, Jena, Lyle, this is great to have you guys come on. And for those of you that have been kind of just listening into this, I mean, what you just heard to me isn't just a story about a company. I think it's a reminder that innovation doesn't always start in a boardroom. It starts with proximity. It starts with listening, with noticing gaps that no one else seems willing to fill. And when I just from this conversation, Lyle and Jenna, I mean, you didn't create Perfecting Peds to chase headlines. Like you built it because there's a lot of kiddos that are being treated like small adults in a system that was never designed for them. And because parents are navigating sometimes blindly and placing trust in clinical professionals that may not necessarily have the training. There is a big gap there. And I didn't know that that gap existed until today. And we could do better. So if you're thinking about today's conversation and whether it moved you or challenged you or made you think differently, then share this episode. And if there's a topic that you want to explore further or a leader you want us to have come onto the show, yeah, drop me a note, leave a comment. The platform Managing Healthcare Innovation Consortium, it's about community. It's not just content. So thanks for listening and keep building with purpose. We'll see you next time on the Advancing Healthcare Innovation Show. Bye bye.